we are willing to adapt to the current technology and change our approach to teaching and learning to hopefully make them better pharmacists in the future.
I love the idea of having the education personalized to perfection phrase.
I think we could see personalized education happen with programs that are tailored to the pace of the student by utilizing AI and technology in that space.
Welcome back, fellow travelers. In today's podcast, we're discussing the role of artificial intelligence in higher education. Today, we're thrilled to have the prestige honor of having Dr. Kaitlin Alexander, a clinical associate professor at the Department of Pharmacy Education and Practice at the University of Florida. Dr. Alexander is deeply involved in the critical care medicine and other prestigious pharmacy associations, with a ranging interest in critical care management to infectious diseases. And her innovative use of AI in pharmacy education has set all new standards, making her the perfect expert on today's topic around AI in higher education. Dr. Alexander, welcome to the show. It's a pleasure to have you.
Thank you so much for having me on, Steve. I'm happy to be here.
Welcome to the show. So I really want to dive into this here. So recently you were named to have this prestigious honor of the AI Teaching Integration Award, where you were recognized for using artificial intelligence in advanced pharmacy and practice experience that has not been traditionally used in the classroom. So can you share a little bit about how you first decided to integrate AI into kind of the critical care and what really inspired you to have this type of innovative approach?
Yeah, absolutely. So I'm really fortunate to be at the University of Florida, which has a lot of support and momentum behind artificial intelligence, but also integrating artificial intelligence for teaching and learning. And so I started this journey last summer, never really interacting much with generative AI, and started to really gain an interest and see the possibilities and the uses that it could have to, I think, advance education for students and for faculty. Through that, I found a faculty learning community, though, at UF that was focused on harnessing AI for teaching and learning. So I participated in that last fall. And that was really a huge eye-opener and learning experience. I would say some of us kind of described it as drinking from a fire hose of all of the ideas and technology that we are introduced to, of how we can really bring AI into the classroom and into our teaching. So from that, I started to get a lot of creative ideas, network with others in the group that had similar interests, and develop this idea of how I could start to bring artificial intelligence to my experiential rotation. So as a clinical faculty member, I have didactic teaching responsibilities in the classroom. I also take fourth-year pharmacy students and residents on rotation in the trauma ICU where I practice as well. And so this is a really unique opportunity where I'm working with a small group of learners on rotations, and we collaborate on our topic discussions where I may have a group of 5 to 7 learners during a rotation block. And we focus on different topics that are related to the care of trauma ICU patients during that time to add to their learning experience. And I've been teaching the same topics for every single rotation block for a really long time. And I thought AI would be a creative way to kind of reimagine what that topic discussion looks like.
That's extremely,
And then,
yeah, go ahead.
So I was just going to say that, and so that was kind of the initial idea of how can I spice things up, make it more interesting, but also integrate AI for the student there.
That's an incredible use. That's an incredible use case here. And I wonder, just give me a little bit of background, kind of before this journey started here, what was your exposure to things like generative AI? Did you already kind of have a real kind of fundamental knowledge of it? Was it something you were around in the academic kind of environment where you kind of have a foundational knowledge of it? Or was it something you had to kind of get into, start learning some of the foundational building blocks of it, understand kind of what it is before you can learn how to apply it? Where did you really start with this?
I had no previous use. So I am by no means an expert, and I have been on this journey trying to learn as much as I can over the past year or so now, really. And so that started with, what is generative AI? How does it work? How do these models work? And what can they really do? What are the possibilities? And so that's where I started from. And honestly, through uh, a lot of my own kind of self research, if you will, webinars, other opportunities that I think have really started to come up within teaching and learning higher education. That has helped a lot to get some of that foundational knowledge. And also, again, this faculty and learning community that I was part of really provided a lot of that. We heard from experts, at the University of Florida that are AI experts, right? And learned from them what it was, and then ultimately how we could use it. And so I'm really an end user here, and I've gained a lot of my ideas and experience now just through that action of playing around with AI, seeing what it can do, seeing what it can do for me and for my students and learners.
And really the goal of it was, by looking at the article, was the students responded positively to the AI activities, but the goal of it was so that the students could understand the uses and limitations of AI and evidence-based medicine. Kind of walk me through, was it what was it about that AI that they needed to learn? Well, the limits and the limits around the use cases around that. What was the goal of that?
Yeah, so we're really in an interesting time here, right? AI is pretty new for most people, my students included. And so these current cohorts that are in graduate programs, doctorate programs like our PharmD program, they didn't have the same experience that undergraduate students are having now, where AI is being integrated into maybe their K through 12 curriculums, undergraduate curriculums. It's very new to my student cohort still. And so they haven't had a lot of experience and exposure. And honestly, their past experience has been don't use it, it's cheating. Right. So they've kind of closed their minds off to the uses of AI, especially when we're talking about classwork or an assignment from a professor. So in this case, I wanted to expose them, though, to what AI can do. And also, though, that especially in healthcare, there are a lot of limitations. If you're asking for medical advice or a question, the information may not be completely up to date and may not be fully accurate. And so you really need to trust but verify. And of course, we're seeing the models get better and better with the information that they're providing and the accuracy and the sourcing and the citing of information. But especially initially, that was a huge concern with these hallucinations. I was reading a journal article that I knew wasn't in the model previously, and I put it in and asked it to give me a journal club or a synopsis of that journal article, and it completely made it up, right? And so I want the students to know that, yes, this is a tool that is out there that they can use that will be very influential in healthcare during their careers, but they need to know that they need to also combine that with their own knowledge, expertise, verify the information, verify the sources, conclusions before they bring a recommendation to the bedside that would impact patient care. So ultimately, that's what we worked through kind of in this topic discussion together, giving them short cases that they could put into a generative AI tool, seeing what the response is then, and then real time, I facilitate discussion with them of what do you think about that? Is that what you would recommend? Why or why not? What do our guidelines say? What does the primary literature say? And let's literally dig in and critique what you're getting out from your generative AI tool.
It definitely seems like that's a wonderful approach because you're looking at AI as a tool, and then you're also having the students look at it and evaluate it to see if, in fact, the information is correct based upon certain data. You mentioned sometimes the data model is not always perfect and it gives inaccurate information. Sometimes there's hallucinations, and it's up to the person who is kind of the subject matter expert or who is more the practitioner in the field to really look at it and kind of make more of that informed or data-driven decision. I wonder how did the students react to it when they heard that I couldn't use ChatGPT or I couldn't use any of the other AI tools for classroom work, but here I get a chance to actually do some AI work in this. Whoa, this is blowing my mind. Like, what was their reaction to this?
I think that was their reaction. They're like, "You want us to use AI? What?" They were surprised, right? They've never been told, "Yes, I want you to use this as a tool. And I think they thought it was really cool. I think it shows that, right, we are willing to adapt to the current technology and change our approach to teaching and learning to hopefully make them better pharmacists in the future. So they, I had some that were really excited, right? Especially those that were already maybe using an AI. Some that were apprehensive, though, as well, right? Because they have been told, don't use this, kind of stay away. And they had never even had the opportunity to kind of play around with it, know how it works, or what to do with it, what to expect. So there was definitely a mix, and a mix of experience that students have right now with how to use
Mhm.
AI.
So it seems like there might have been a little bit of a skills gap kind of amongst most of the cohorts, right? Some probably were very proficient at using some sort of AI tool, some were not, right? So I'm sure you probably had to have some sort of ramp up period for some of those folks to get ramped up on the tool before they can start evaluating it here. How did you narrow it down to maybe a specific AI tool? Like what was the decision that went into how you look at the landscape of artificial intelligence tools and language models and different things? How did you kind of narrow it down to maybe one or just a few that really were going to be fit for purpose for particularly your use case in the classroom?
Yeah. So when I first started this idea, I immediately kind of went to ChatGPT, just being that it's readily available, using the free unpaid version, the 3.5 model, because I wanted it to be accessible, or I needed it to be accessible for all of our students, right? And we can't expect them to pay for an additional service or AI tool. So that's one consideration, is just the cost associated with some of them, and that being a limitation when you're asking a student or a learner to engage with the tool. And then the other thing was the purpose, right? Like, so there are other AI tools that I've played around with. One that I considered, for instance, in this assignment is perplexity.ai, that is a little bit better with giving some of the sources of its information. It's meant to kind of be more of a search tool of the literature, along with giving kind of an overview. So that's another one to consider. And I think any of the kind of open AI models could work well for at least the type of assignment that I adopted. And I didn't want to be too prescriptive. If the students did have experience, they were welcome to use another tool of their choice. But to me, ChatGPT is the one that's most common. Students know the
Mhm.
name. And, if I wanted them to get experience maybe with one tool, that was the one that I went with. Now that's also changed already, right? So the University of Florida now supports Copilot for both faculty and students. And so that is secured once we're logged in behind our GatorLink login. And that is what we are being encouraged as faculty to kind of use with our students in the classroom now, if we're going to use a generative AI tool. So in the future, and what I've been doing now is utilizing Copilot for these assignments.
I was just going to ask you kind of like, kind of now that you've been able to prove this prototype happening in the classroom and having a profound impact on the learning experience for the students and also being able to actually really solve real world use cases. I wonder what the implication has been kind of across the college faculty now. Of course, we know that AI is really kind of starting to move into higher education. And I was very curious to know kind of now that we start to see the emergence of ChatGPT, Copilot being integrated, secured in a specific environment like universities. I wonder how it's basically been playing a role within maybe enhancing things like within the faculty, whether it's within efficiency within course development or something like that. Could you talk to a little bit about how it's now starting to kind of bleed into other areas within the faculty of the university?
Yeah, I think that this is a huge topic with faculty. I mean, like students, we have faculty that have been early adopters and jumped on the AI train early, and some that are still, I don't want to say lagging behind, but I'll say lagging behind, right? Where they are still making their opinions and maybe haven't played around as much with it. Because I think it has a ton of potential to help with faculty workload and efficiency, and it's a tool that we now have, and a tool that's now supported right through the university. A lot of the areas where this has been explored for faculty, though, is with test item writing. It can be really challenging and very time consuming to come up with a multiple choice exam of questions. It's kind of the one of the things of being faculty you don't always think about. So getting ideas for questions, generating questions from AI based on content has been really helpful. It can also be used in course development, course mapping, thinking of how you would create or approach new course content, goals, writing objectives, assessment instructions. So I've come up with the assessment I want to, have my students complete, but help me just write up the instructions so that they're clear and the students know what they're supposed to be doing. It helps me summarize information for presentations. I have a PowerPoint slide that's super wordy. I can put it into Copilot and tell it to make it into shorter bullet points. Saves me a lot of time and efficiency coming up with that myself. So there's a lot of uses there just from your faculty tasks that we're completing. And then I think there's a whole other realm of possibilities of how this in the future is going to help support research, data analysis, qualitative analysis of large volumes of feedback, for instance, that our generative AI models are really good at summarizing and really good at summarizing in a short amount of time.
I love the idea of kind of having the education personalized to perfection phrase. Somebody had mentioned that at one time, kind of keeping an eye on how it's going to kind of allow us to kind of tailor make these resources to have more of an adaptive learning experience that really has a more of an ebb and flow to the student's academic journey. We know that professors and university teachers have a lot. So you mentioned things like multiple choice questions, grading, and being able to synthesize large amounts of data to be able to summarize it for you quickly. Kind of offloading that differential heavy lifting into kind of an AI model that allows you to free up time to focus on the things that really do matter in education. And I know that there's been some big players in the market. There's been a huge growth within AI in education. I know there's, Microsoft, Google, Facebook. They've really been pioneering a lot of development into the AI space. But I kind of want to ask the question around things such as, what are the ethical uses that you maybe even you talk to other university professors, or maybe some of the things that the faculty or maybe the university is talking about is kind of the ethical use of AI in education. It always seems in technology, we use it, it's great. But then you get into education and it's a different conversation. There's many more different levels of complexity. Can you kind of expand on a couple of things that you might be able to talk on around this use case around ethical use?
Yeah. I mean, there's a lot of concerns and challenges with implementation and making sure that you're implementing appropriately. Um, One of the biggest things that comes to mind initially is just the confidentiality factor, right? Especially when you're using an open AI model. When I'm working in healthcare as well, so you obviously don't want to put in any patient information to the model. It sounds obvious and straightforward to, I think, those that are in the know, but to a student that's on rotation and has a patient specific question, they may not think about, putting that information into the model. Same thing in education, though, in higher education, we have FERPA laws that we follow, and so we need to maintain student confidentiality with any information that we're putting out there into the model. So I think number one, that's a huge ethical issue and concern just with generative AI use and how students may use it. There's other challenges that faculty see. Academic dishonesty is another big issue or concern that comes up of students utilizing AI to complete their assignments and not putting in the work, the time, the effort themselves. And we know that the AI checkers, if you will, are not accurate. It's very difficult to tell if it's a student, a student completed this assignment themselves or if it was written by ChatGPT. We'll never know or be able to prove that, right, in an academic dishonesty situation. And so a lot of professors are kind of turned off by that and don't know how to approach that. And personally, I think that it's education of our students, right, about the appropriate use and having them cite the use of AI when it is utilized, sharing how they utilized it for assignments, being open and honest about that with them when I'm using AI so they can see that modeled for them. And that way that can help ensure, an authentic student assignment and assessment. Um, so those are some big challenges that we're facing. The the bias also that we see with responses and things that you receive from generative AI is another kind of hot topic, and then just the fact of potential misinformation, incorrect information, hallucinations, and how that may impact the students' learning and overall education. If we are encouraging use of these tools, wanting to make sure that they're getting the information ultimately that we want them to get to achieve their kind of curricular outcomes is of top importance.
When you mentioned the biases in the AI and things like that, and kind of talked, a little bit about what are some biases that you're trying to kind of safeguard against. As technologists, many of our listeners, roughly 50% of our listeners, may or may not be in the technical field, but for them to understand, kind of what is an AI bias, what is it you're looking for when you're trying to kind of guardrail against that.
I think a kind of simple example that comes to mind, right, is I utilize AI to help me come up with maybe, for instance, patient cases on certain disease states that I'm trying to teach in the classroom. And it can give me a starting point of a patient scenario, details to include that then I can expand upon and use that for case based learning with our students. And there are certain disease states, though, right, that tend to occur maybe more frequently in certain patient populations, certain genders, certain professions. And if you prompt generative AI, then that's when I see, for instance, those biases come through, because then the patient scenario that it comes up with is always going to fit kind of that mold. So that's one example. And so I think we just want to be careful with our students of them understanding and knowing, right, that that's not always the case 100% of the time, and that there may be, certain bias introduced there. There's also bias in if you're asking a question, right, and the types of information that you're going to get out that again may lead you down a path to get to a potentially incorrect answer for a patient that doesn't fit the general mold. And I talk a lot about patient care because ultimately I'm teaching pharmacists and we're preparing them to be taking care of patients upon graduation. And so I really want to make sure that they are prepared to appropriately utilize the information that they're getting to make the best decisions for their patients and all of the teaching that we're doing.
When you mention patient care, for you as you look upon like the future and the landscape of AI and where this is really kind of headed, where would you kind of see an ideal scenario of kind of the perfect complement of AI with the right type of clinical analysis, the right type of clinical research that really drives an enhanced patient experience? Like, what do you kind of see? What do you envision? What's the future look like for you?
I think that's a big question, Steve. There's a lot of opportunity. I think there are certainly a lot of AI platforms already live and out there that are tailoring to patient care and, for instance, helping to make a diagnosis if you put in some patient information, you know, de-identified patient information to help come up with a diagnosis and a treatment plan on the spot. And I don't think that we're that far away from seeing that really go live in a widespread capacity where it's integrated into our electronic health systems. And if I have a resident that's rounding on a patient and they don't know the answer to a question, that they could pull up this, chatbot essentially within the EMR and ask a question and get an answer of what medication am I supposed to prescribe? What dose is correct for this patient? What would you recommend? So I think there's a lot of opportunity there to, again, help. Another area in healthcare is just with writing and documentation. So it's a lot. I'm sure you can understand or know that physicians, providers are incredibly busy. They see a lot of patients throughout the day. all of those patient visits need, associated documentation. And so what I see from my colleagues is that they're able to see all the patients and do the clinical work, but then they still have 50 notes to sign at the end of the day or to write. And so AI can also be really helpful. And I think we're already seeing that be implemented in healthcare to help them with the documentation piece of their patient visits to make that more efficient as well. So lots of things going on in this space. I certainly am not going to pretend to have all of the answers or ideas. I'm sure there's a lot of other things happening too, but those are just some of the things that I'm seeing or potentially foreseeing in
Mhm.
practice.
And how do you see kind of more of the evolution happening within AI, kind of more into more things that you may have within within your classroom setting? You mentioned, pharmacology. You mentioned kind of the patient care. You mentioned this is a great win for you because you've been able to showcase that it is a very valuable tool. You can have a very positive outcome with when you include AI into a proper classroom setting with the proper guardrails and instructions with it. What do you see as kind of the next venture into kind of prototyping something else like this, but maybe a little bit different?
There are, again, same thing in education, so many different opportunities. I have a ton of ideas of other ways that I'd personally just like to incorporate AI into my teaching, into my courses. One of the next projects I'm working on is potentially enhancing students' own self-reflective behaviors by utilizing AI, getting them to think more deeply about their own self-evaluations and kind of interviewing with a chatbot to get to that deeper level. Inherently, I thought that AI should be avoided for reflective writing, and I'm actually finding now the opposite again, that it can be a really exciting and powerful tool there. So again, just lots of ideas there. On a higher level, I think we could see personalized education happen, right? With programs that are tailored to the pace of the student by utilizing AI and technology in that space. The launch of GPT
Hmm.
4.0
Yeah.
yesterday, right, with the ability to um, interact with a person via video, voice, huge for education and other possibilities of how we could implement it. For my students, I'm thinking about practicing their interactions. How would they interact with this with a patient? How would they counsel a patient? What questions would they ask them? Right now, we simulate all of that in a skills lab environment with sometimes simulated patients, or we have also patients that we hire in, right, to come play that role. And now I think in the future we could do that with AI, right? So lots of possibilities, and I think lots of changes for higher education and for learning in the future.
It's funny you mentioned, more of the cognitive personas about difficulty with dealing with patients, kind of in a hospital setting, right? I think that that's an interesting one. Is that you get all types of personalities, right? Happy, sad, and all the different ones. It's interesting. So you said that you get some people to come in to play the role of the patient, and you say, okay, go over here and trying to diagnose this person, and the person's in a really bad mood or something. When you mentioned self-reflection, I'm not really too sure about what that one is here. So when you mention having students use AI for things like self-reflection or not using AI for self-reflection, what does that really mean? Help educate me.
Yeah. So, I mean, I want our students to be lifelong learners, which means that they have to have the ability to self evaluate what their strengths, what their weaknesses are, where they need to continue to grow. At the throughout the pharmacy curriculum, and then also particularly on rotations when they're on their experiential rotations with me, they fill out their own self evaluation alongside my evaluation of them. And what I see a lot is they just click through the boxes of the evaluation and they don't add a lot of additional detail or examples to support, why they think they're doing so awesome in this one area, why maybe they ranked themselves lower in another, and also what they're going to do about it if they aren't performing well in that certain area. And so, what I foresee or what I'm trying to implement is I've created a prompt where they can interview with AI in these domains, right, that I'm evaluating them on. And the AI is prompting them back with questions of, tell me an example of when you did that well. What was the outcome? What would you do different next time? And giving kind of that feedback that I'm hoping that they can utilize to then put into their own self evaluations. And again, kind of reflect deeper than what I'm currently seeing, where students, not all of them, but unless I'm very specific about, I want you to come with, which I've learned in the past too, 3 strengths and 3 weaknesses of what you're going to work on for the next 3 weeks or until the end of the course, they tend to not come with a lot of specific examples or areas for growth. And so I'm hoping that AI can be a tool that we can utilize to help them with that. What I was sharing about my hesitation is though that reflective writing though to me really needs to be about you coming up with your own thought process on things, right? And so you using generative AI to write a self reflection, I was like, well, that shouldn't be allowed. That was my gut kind of instinct. But with this approach, I'm seeing that they are providing the examples, the students are. The AI is just asking them questions back to make them think more deeply about the example and potentially what they could have done differently to improve or do in the future to improve. So that's what I'm really excited
That's
about.
interesting. So it was going to almost kind of dovetail right into my next question, and it kind of as we start to kind of come into conclusion is, for the people who are our majority of our listeners are technical people, most of them are non-technical. What would you love to see from the tech community, people who are writing, working in the large language models, people who are working with very different versions of artificial intelligence, people working in the generative AI space. For them, what is your message to them? How can we improve AI in education? What are some things that we could be looking at from a future perspective on things that we should be focused on building into our programmings now and also into the future?
Yeah, I think there's a lot of things out there that I probably have not tapped into. So I apologize if these things are made and and I just don't know about it or haven't used it yet. But I think support for giving, which I know we have this too already, but support for giving feedback, grading students more efficiently, especially in really large courses, is something that is difficult in higher education and really being able to give formative feedback to students. So, utilizing AI to kind of help with that is one area that I would foresee being very impactful, kind of with student assessment overall. Um, there, I think growing AI applications where they can be tailored more so to a specific course, right? So that's another area where I want to maybe take my course and make its own GPT, right? So I know I have the capability of doing that. And then right now I'm limited though, just by the cost standpoint of being able to make that available to all of my students, right? In the cohort. And so making access more freely available. Again, with this announcement from GPT, it sounds like they're looking at that model going forward, where hopefully we'll be able to make some of these on GPTs for our courses that would be really impactful for student self-learning, right, where they can interact on their own outside of class and study with it and do more there. And in the healthcare space specifically, I think just more accuracy is needed, honestly, tailoring those models to medical conditions. Again, in the medical literature, again, I know that that's out there and people are working really hard on that. It's just not something that's readily available right now, again, to the end user in healthcare, taking care of patients. And what I see right now is that there's still a lot of inaccuracies where I don't trust the initial response as kind of the expert in the field. And I'm nervous about that at this moment in time for my learners, that they're they're not going to have the expert knowledge, right, to critically evaluate that response that's not the best choice for their patient
Mhm.
ultimately, right? So I think in that healthcare space, it's really more so about the accuracy of the information that we're getting.
And great question, and I wanted to kinda just double click on this one here. When you mention healthcare, it tended to be a very broad lens that you could look at it from, and you say that, there's data models that are very inaccurate. There's data models that have, incorrect or maybe there's some misinformation in there. From a healthcare perspective is, who would you be looking at in terms of kind of the trendsetters or industry leaders when it comes to AI? Would it be something like, health insurance companies, healthcare institutes, pharmaceutical companies? Who would kind of be kind of like that North Star shining light for you when you were to say, if we were to look at this AI model from, you don't have to mention a specific company, but is it a specific, like, who would kind of be an industry leader for you to look at as a North Star of this is kind of what we're striving to?
I think that's a great question. I don't know that I have an awesome answer for you, Steve. I can tell you what would be probably most impactful, though, is working with our electronic medical record companies to implement the AI. When it comes to developing the model, I mean, I really want to see the evidence based medicine incorporated into there, right? Our latest guidelines are primary literature. That's what we really base our decisions off of in practice. And that's my kind of barometer for coming up with the best recommendation for patients. It's not looking to a health insurance company to tell me the answer based on their formulary, right? We have to take that into consideration when we're making treatment decisions for patients, because obviously the financial aspect is a huge part of whether or not they're going to take their medication. But ultimately, I want it to be whatever is going to be best for the patient and their condition, if that makes
Yeah, it
sense.
does. You kind of want like an biased opinion almost, right? Like, yeah.
Right.
So it's like insurance companies, of course, are going to probably skew some sort of predictive or prescriptive analysis based upon current trends and what they would like to see based upon their actuarials or something like that. So it's interesting. I'm kind of curious now. It's like you mentioned health, the employee record or the the health records that are being kept, but then also still being able to use AI to be able to look at a broad set of data, and then still kind of have almost kind of like a board or peer review of the data to kind of everyone kind of go back and forth to see if in fact if this is the best outcome that we're looking for something that is very patient centric, correct?
Yeah, and I think that's where the money is, right? Like if we can synthesize real patient data and outcomes into an AI model and then work from that, that's what's going to be huge and changing healthcare kind of going forward. And I know at UF we have researchers that are working on building those models within specific patient populations and trying to collate all of all of that data right into um, into a model. And so I think those are the areas that are going to be really impactful for patient care and really help us look at outcomes, make informed decisions based on patient outcomes, and then ultimately improve care.
I think that's the biggest message is, of course, just trying to improve the patient care. um, Dr. Alexander, I really want to thank you for your time today. Thank you for sharing your thoughts and insights with our listeners. I know this is a topic that I've been wanting to dive in deeper onto. Hope to have you back on the show again. I would love to explore this to keep up with your journeys as to kind of how you're progressing with AI in the classroom. Um, I certainly hope that your students also have this great experience where they go, yay, we could use AI in the classroom. Yes, Dr. Alexander is awesome. This is the best class ever. Please take our class. I don't know, something like that, probably, right?
Me too. Good evaluations would be awesome from the
Wonderful.
students.
Well, again, Dr. Alexander, thank you so very much for this opportunity. Look forward to the research you're doing. How can people follow you to keep up with some of the great things you're doing there at the University of Florida?
Yeah, absolutely. So, I mean, you can feel free to reach out to me via email. It's readily available on our website through my faculty profile. So that's probably one of the better ways, other than your typical channels like X and whatnot. I'm at K Alexander 4218 if you want to look for me or take a follow. And yeah, I would love to connect with anybody who's interested in chatting more.
Wonderful. Well, Dr. Alexander, thank you so very much for your time. And thanks everyone for listening. This has been an illuminating show. Thank you so much for your time and thank you for listening. Cheers.
Thank you.